So, I think I know just about all of you, Many of you have seen me in my other offices, in my home, which was down the street. Bought this building in 2019 and then started attracting amazing people. So I'm the first in a lineup, and I'm only going to talk for a couple of minutes because we have a wonderful lineup of individuals here, doctors, nutritionists, acupuncture, to talk to you about the different aspects of cardiovascular health. My passion actually, recently, because I got a cardiology certification last spring, my passion is working with individuals to understand how to get tested, how to best get tested. And this involves a conversation between you and your doctor. So as you probably know, cardiologists test you for your cholesterol, correct? Anybody here have high cholesterol? Oh, a little bit. Anybody here on a statin? You don't have to raise your hand, okay? So if you didn't already realize it, statins might not be the right medication for every human, okay? They might have side effects. If they don't, well, that's great. If they do, it can be debilitating. And we also don't often get the whole lineup of tests that might be appropriate to see if the medication you're taking is the best one for your particular type of cholesterol, okay? So my favorite then thing to make you understand is that you have a lot of rights as long as you have information. And you can ask your doctor for extra tests if you want to. And if they say no, then that's a red flag, isn't it? Because you want to get information about your body and not just be treated by your doctor like every other patient he might have seen that morning, which could have been 15 people, right? All getting the same drug and maybe even the same dosage, for different sized individuals. So we're trying to here create an atmosphere of individualized preventive medicine. So let me just talk to you about some of the tests that you might not have heard of. This is like an overview of what we're talking about today. Advanced testing for cardiovascular health, and that's me, in case you don't know me. All right, so, first $1,000,000 question individuals ask is, I don't know if this is going to be covered. Is this going to be a $4,000 test? And I say, no. Actually, most of the tests I'm going to talk about tonight are tests you can get through LabCorp. And if your doctor knows the right codes, it gets covered. If your doctor doesn't know the right codes, I will give them to you. You can Google them. It's actually very easy to figure out coding so that your insurance company will cover your tests. All right, where was the pointer?
Below the down button.
Thank you. Ooh, look at that. So you can actually get tests like an ApoB, an OX-LDL, insulin resistance through a conventional lab. That's LabCorp request. Has anybody heard of any of these? Okay, a few hands. So what we're talking about now is how we're going to truly understand if a statin is the right drug for you. That's the first thing we're going to make sure you know before you leave here tonight. But I also wanted you to realize that there's other tests that you might need in order to understand your cardiovascular risk that go beyond cholesterol. So we've been told we have high cholesterol and we need to get a statin in to make that go away. We haven't really been told that statins don't technically reduce your cardiovascular risk very much. So we have a very significant issue with cardiovascular disease in our country that really isn't being met or addressed or fixed with statins. The true cause of heart disease is not actually cholesterol, it's inflammation in your cardiovascular system. These are the inflammation tests. So that's easy, right? We're just going to want to do some inflammation tests. And when we think about inflammation, what do we think about? Maybe a headache or a swollen knee? But if you have silent inflammation in your cardiovascular system, that's what's causing heart disease without you knowing it. And guess what cholesterol does? It tries to actually calm down inflammation by packing into areas of the arteries that are inflamed, and that's where we get heart disease. That's where we get that's where we get coronary artery disease, meaning the cholesterol sticking in there and then things get stuck. All right, so oxidized LDL is one of our, what was it?
Down arrow.
Bottom one. All right. I need an assistant.
Hold on.
Thanks.
Mm-hmm. Sorry, guys.
So do any of you ever get tests besides patients of mine that go beyond the cholesterol? Good. So your cardiovascular specialist, your cardiologist is doing a few extra tests? That's good. Okay. And where was the pointer? I know you just told me, but then oh, okay. I pressed the one you told me not to press. Okay. So I was talking about the cardiovascular, the tests that cause, are markers for inflammation, and that's where this list is here, and I believe everything that I listed here is on your worksheet there. Okay, and now I know how to go to the next one. All right, here's where I wanted to talk about the test that tells you whether you need a statin or not. So you've been told you need a statin just because you have high cholesterol, but what your doctor might not realize is that there are people who produce cholesterol, production markers, and then individuals who absorb cholesterol from their food. So this is sort of talking about the individual who's been told that they have a genetic cholesterol problem. That means you genetically have a propensity for producing more cholesterol. And guess what? The statin fixes that. It helps you to not produce so much cholesterol. So, but what if you happen to be the people or among the population that absorb it from food? The way they get around that is just tell you to stop eating fat. Well, is that a good idea? You can tell from my grimace. It's not a good idea to stop eating fat. And Julia is going to tell us why in a few minutes, our nutritionist. So what we want to do is think about testing you to see if you're a producer of cholesterol or an absorber, because there are different approaches then to lower your cholesterol if it's truly too high. That would be specific for you. If you're a producer, you may benefit from taking a statin. If you're an absorber, you will not benefit from taking a statin. Okay? So, the next test I wanted to make sure you know exists is a genetic test to see if you even tolerate a statin. So this will tell you before you go home with the drug and get muscle aches from it, whether you're going to get muscle aches. I feel like this is something that everybody should be tested for before they're being given a script, right? Because if you have an adverse reaction to a statin, that could be a few months that you're feeling poorly when you could have known that and avoided that whole problem. So this is actually a genetic test, also by the same company called Boston Heart, that will tell you, why do I keep doing that? That will tell you if you need a statin, if you're taking a statin, whether you're going to actually get muscle pain from it. I think I should just not have this anymore. So if you have muscle pain after you take a statin, you have to tell your prescriber about that. They will try a different one, and then they'll try a lower dose. But what we would really want to do is go to the previous slide and find out if you even need a statin, if a statin is even going to work for you. So that's where we would do the cholesterol balance test. Okay? This one, covered by insurance. Next slide. This one isn't. But guess what, how much it costs? $50. That's not bad, right? So why not, right? Let's see if I have any more slides. All right, I don't, because I wanted to keep my part short. I just want to make sure that you know that you have rights. You can ask for labs. You can ask for the things that I've listed here. If you need more information, you can go to Boston Heart's website. They have a huge website with learning tools and such. You can even call us and I'll tell you what to do, okay? And now, without further ado, we have our nutritionist, Julia Marzoka, to tell you more.
All right. Hello, everybody. So as Dr. Jen said, I'm the nutritionist here, and a lot of you probably know me at my role at the front desk the past couple of years, and I earlier this year graduated with my master's in nutrition, and so I'm super excited to talk to you guys about nutrition and cardiovascular health. There is so much we could talk about, so today the focus is kind of on common misconceptions about diet and cardiovascular health. So we'll just kind of scratch the surface of those things. All right, so we'll start out by asking you guys a question. So these are the big three that are often implicated or discussed when we talk about cardiovascular health: salt, sugar, fat, and cholesterol. So by raise of hands, and you can raise your hand for more than one as well, which do you think, from your knowledge, is more problematic for cardiovascular health? So raise your hand if you think it's salt. Okay, who thinks it's sugar? All right, and then what about fat and cholesterol? Okay, all right, and we will dive into the nuance now. So thanks for participating. So starting out with fat and cholesterol. So I'll kind of introduce what the common claim is, and then we'll dive into why that claim exists, and then talk about the nuance with the topic. So the claim with fat and cholesterol and cardiovascular disease is that when we eat foods that are high in fat, specifically saturated fat and cholesterol, our risk of heart disease is increased. That's the claim, right? And so to make a very long story short, there's quite a long history as to, why this ideology has come forward. And so it kind of goes back to the 50s with a researcher named Ansel Keys, who did a study called the 7-Country Study. And this is kind of the beginning of a series of various observational studies that showed, it looks like people who eat more saturated fat and cholesterol have more heart disease. And flash forward, there's a lot of critique around these types of studies and using them as causation versus correlation. But throughout the years, the 50s, 60s, 70s, there was kind of this back and forth between researchers, and there was like the fat is the bad guy camp, and then sugar is the bad guy camp. And there was this back and forth. There were lots of studies that were coming out implicating sugar, lots implicating fat. And when it all came down to it, for a variety of reasons that we don't have time to get into tonight, around the 80s is when the low fat prevailed. So the Dietary Guidelines for Americans, which is our government's, kind of official way that we disseminate nutrition advice, which is, run by the USDA and the Department of Health and Human Services, they used the research that stemmed from Ansel Keys to say, hey, we should be eating a low-fat diet, and that's good for heart disease. And that kind of exploded in the 80s, and now we have a lot more information, we have more nuance, but that ideal does still prevail, and so I'd like to get into the nuance. And Dr. Jen already kind of alluded to this. The reason that we associate fat and cholesterol with heart disease in the first place is because when you see a clogged artery and you're looking at the plaque, there is fat and cholesterol in the plaque. So it's kind of there at the scene of the crime, so to speak. But the nuance is it might not be the root cause. In fact, it's not the root cause. It's not the villain that we thought it was. And so I like to say that fat in the context of cardiovascular disease is kind of guilty by association. So when we look at an artery with plaque in it, we see all of this fat and we're like, okay, well, there's a lot of fat in the arteries. I guess I should be eating less fat, right? But we have to ask why the fat has come to this crime scene in the first place. And this is very small, but it starts with inflammation. As Dr. Jen already alluded to, we have some inflammation in the blood vessel for a variety of different reasons. Diet can be one of those. And then to repair the blood vessel, fat and cholesterol come in to almost add this padding. And so it's benign in nature. It's really there for good, but of course over time it builds up and causes problems. And so after the 80s and more recent years, we do actually have a lot of new research to show that this correlation between saturated fat and cholesterol in terms of what we're eating and the risk of heart disease is not as solid as was expressed in the past. It's a lot more nuanced. And just kind of a fun fact, back to those dietary guidelines, up until I believe it was 2015 or 2010 or 2015, the guidelines had a specific requirement that Americans should have less than 300 milligrams of cholesterol. And it has since been updated. So there is actually no longer a sort of dietary limit for cholesterol because they have discovered that it's actually not as much of a problem as was thought in the past. And then, I just like to kind of clarify too, there's an interesting relationship between the food that we eat and what's running through our bloodstream. So the fat that we put in our mouth is not necessarily the fat that's even showing up in the arteries, because our body, our liver specifically, is making a lot of the fat when our body needs it. So when there's inflammation, the liver's got to make cholesterol to go to the, like I said, scene of the crime to do some patchwork. And then sugar, which we'll kind of jump to later, but just as a bit of a primer, when we're having excess sugar, that can make our liver make more fat, and you get the picture. So it's not as simple as I eat fat and there's fat in my blood vessels. There's a whole other process going on that makes us has to address other factors. And also, fat and cholesterol are so important for our health. I mean, cholesterol is the precursor to so many of our hormones. It's what we need to make vitamin D. It's in our brains. And so, fat should not be demonized in the diet just because it happens to be in the arteries when there's inflammation, which a lot of times is due to sugar and smoking and other factors. So, key takeaway, fat and cholesterol are not the culprit. It's kind of more about the quality of the food you're eating and the overall dietary pattern, and looking deeper at why is the inflammation there that fat needs to even be there in the first place? So moving on to salt, this is kind of another one that gets talked about a lot in cardiovascular disease, specifically hypertension. So the claim here is salt is the cause of high blood pressure, and we should kind of as a population be universally reducing it, avoiding it, even if you're healthy, but especially if you have hypertension. And so again, I'd like to explain where is this coming from, right? It's not necessarily coming out of nowhere. Salt pulls water in, or I should say water follows salt. It's just kind of a law of nature. When there's a concentration of salt, water is going to go that way. So in the blood vessels, when we have salt going through, water is going to go from the tissues into the blood vessels. And that's actually why when we talk about hydrating yourself well, we say, oh, you want to have electrolytes with your water, because those electrolytes, aka salt, potassium, etc., are helping to pull water into your bloodstream, which is a good thing. The problem is, of course, when it's happening too much and for too long. But salt sensitivity is a nuanced situation. So the degree to which intake of salt is going to actually cause an increase, and much more a chronic increase in blood pressure, varies based on person to person. And it's important to note too that because of how important sodium is in our physiology, the kidneys are tightly regulating this. So for most people, when we do intake salt, it's not just hanging out in the bloodstream and causing this blow up, right? The kidneys are regulating and they're processing, and as long as the kidneys are working well, of course. And so the nuance here, which I already kind of touched to, is there's a lot of variation that goes on with, well, why might somebody's blood volume increase with an intake in salt? And so there are some genetic factors, age, of course, as always, diet. Insulin's an interesting factor. So insulin, which is secreted when we eat sugar or carbohydrates, actually causes salt retention. So this is kind of another factor of like, well, salt's there, but insulin's kind of the one that's keeping it there. It's not letting the body do its job. Stress, changes in weight, kidney function, inflammation in the vascular system, etc. So with high blood pressure, we don't want to focus so much on this phenomenon of like, oh, well, salt's in the bloodstream and water comes in and, the pressure increases. That's more of a transient effect. A more chronic and driver of chronic hypertension is looking kind of at the structure of the actual blood vessels. So things like how well does it dilate and constrict? How fluid is it? And that's the function of the cells that are lining the vascular system, which really has nothing to do with salt. It has to do with, other aspects of our diet. Obesity. So when we have more tissue, we need more blood vessels, and this causes more resistance, and that can increase blood pressure. And then kind of an interesting thing too, the thickness of the blood is also a cause of high blood pressure. So what can make blood thicker are things like dehydration, if you're not having enough water, and high blood sugar. So a high amount of sugar in the blood can thicken the blood, and all of these factors are more stronger drivers of chronic hypertension, not just a transient increase in blood pressure. And I would say salt is not the root cause here, right? We're looking at other factors. And similar to how I wanted to give a shout out to fat and cholesterol for their importance, sodium is very important as well. Of course, it's a balance, but sodium along with potassium, these are electrolytes that literally go in and out of the cell to help our muscles contract, to help our heart beat, and to help our neurotransmitters fire and help us think. So we literally need salt to live. And so it's important to not overshoot and say, well, everybody needs to reduce salt, because salt is not a bad guy, it's about balance. And so just kind of to summarize, of course, the effect of salt intake on blood pressure varies individually. And, when we go to the doctor and you have high blood pressure and they say, oh, just reduce your salt. That may help for some people, and if people are eating a really highly processed diet, lots of packaged foods, lots of takeout, lots of restaurant food, yeah, they're probably going to be getting a lot of sodium, but they're also getting a lot of refined carbohydrates and additives and other things that are causing problems. And so we're not telling people to stop using a salt shaker on their cooking, right? That's not the problem. That's not the root. So yeah, salt is more nuanced than we're led to believe, I think. And then the other white crystal, sugar, which is, I think, kind of the more underestimated culprit. And I do feel like nowadays it's getting more traction as a factor in cardiometabolic health. But I want to just call out that word, cardiometabolic. So we're talking about cardiovascular health, but let's zoom out a little bit and talk about the interaction between heart health and metabolic health, which is what we think about when we think of things like diabetes, blood sugar, and ultimately metabolism is how the food we eat gets turned into energy and what those compounds do in our body. And so it has become pretty clear. It was back even in the 50s, 60s, and 70s. Those research studies were coming out showing this, but it's become even more clear that excess sugar and refined carb intake does cause increased risk of heart disease. And that's because the effect of sugar is really getting to the root cause of why heart disease exists, which is what Dr. Jen was alluding to. So when we have high amounts of sugar flowing through our blood, through our veins, the sugar itself can actually cause direct damage to the blood lining. And so that what happens now, we've damaged the blood lining. Now we have an inflammatory response. Let's get the liver to make cholesterol and fat and bring it to the scene. But we always go back to what's the root of the inflammation. High intake of sugar also increases triglycerides. So triglycerides are a fat. So again, we might think, oh, triglycerides, fat. Fat is bad. Most often, triglycerides are elevated from intake of sugar. So really what's happening is we're ingesting a high amount of calories, but specifically sugar. And then the liver, your body uses as much as it needs. And then the liver has to do something with that excess sugar. And so the best, most efficient way it can store that excess energy is in the form of fat, which is triglycerides. So eating a lot of sugar, increased triglycerides, and then that kind of takes us back to triglycerides in the blood are leading to inflammation, oxidation, and on a similar concept with ingesting a lot of sugar, the liver is going to produce those small and dense LDL particles. So this is something actually that the testing that Dr. Jen was referring to can look at, is not just what's your LDL, HDL, but what's the particle quality. Because if you have a tiny little LDL particle that's like a BB gun and that's going through the blood, that's going to cause some pointed damage. Whereas if it's large and fluffy and buoyant, which is kind of the other, so we have small and dense LDL, we have large and fluffy, that's going to cause less damage. And unfortunately, sugar intake is what tends to create those small and dense particles, which leads to, back to the beginning, inflammation in the vascular system. And then just some other things, effects that sugar has is, as I mentioned before, if we have a high blood glucose, it can create a little bit more of a viscous blood quality, which is not ideal. It can elevate blood pressure in its own ways. And in general, eating excess sugar can cause us to store fat. And then we have visceral adiposity, which is kind of that like inflammatory fat tissue, obesity, which leads to all these other things. And so insulin resistance and metabolic syndrome are really this cross section of how excess refined sugar, refined carbohydrates can cause this storm in the body that affects the cardiovascular system and our blood sugar, which are really all interrelated because blood sugar is flowing through the veins, and the veins that's part of the cardiovascular system, so they're super interrelated. So what do we eat for heart health? And the things I'm listing here are honestly components that are in general great for most conditions, right? So we're talking about whole foods, anti-inflammatory, because you probably heard the term inflammation come up a lot. We want to avoid the insult to the vascular system in the first place. And so we do that by consuming an anti-inflammatory diet and other things in our lifestyle that can reduce inflammation. Low glycemic, so that's pointing to this lower, not eating too much sugar and carbohydrates. Colorful plants and fiber, which gives us antioxidants to counteract any damage that is going on, because there's always going to be a little bit of damage going on, and if we're consuming foods that can counteract that, that's great. Omega-3 fats, so shout out to fats here, super anti-inflammatory and wonderful for heart health. High quality proteins and fermented foods, because the gut is also connected to cardiovascular health. And then because I'm a nutritionist, I love my micronutrients, so there's so many different nutrients that we could talk about their its effect on cardiovascular disease. We've got minerals, vitamins, and other things. So
All right, everybody. I'm going to stand on this side of the room. That way I can see everybody's faces. All right, so I'm Dr. Lily. I'm the chiropractor here. So a little bit of shift.
Light.
Oh. Okay, awesome. So a little bit of shift in practitioners, a little bit more physical medicine. Okay. And I get this a lot. What do you mean that chiropractic is for other things other than neck pain, back pain, or headaches? All right. If you are one of my patients, which some of you may be, one of the first things I tell you is that about only 15% of your nervous system deals with pain. The other 85% is function. So that includes everything in your body, all right? Mm-hmm. So heart, all the cardiovascular system, right? All right, so chiropractic's all about the function of the nervous system. That includes our brain, spinal cord, and all the nerves that come out and go to your organs, limbs, everything of that nature. Why is that important? Well, the cardiovascular system, obviously, this is just a simple overview, right? Heart, arteries, veins, capillaries, and then some other organs that a lot of people don't think of, lungs, kidneys, adrenal glands, just to name a few, all right? They all can affect our cardiovascular system, all right? Why is the nervous system important for that? Because it controls everything, right? It is the control hub. It is what the brain communicates through the nervous system to speak to all of these organs. It affects your heart rate, it affects your heart rhythm, it affects the, as I think Julia was talking about, the autonomic system of vascular constriction or dilation, right? That's a lot of that is nervous system flow. Your nervous system is telling your body to do that. It may be via hormones, it may be via adrenaline, right? Whoo, what happens when we, right, get all fight or flight, right? But the nervous system essentially is what controls that in the end. So, what's my role as a chiropractor? It's to help the nervous system function as well as possible. Right, so we locate subluxation, big word that simply means that there's an area in the spine usually not moving properly. All right, what does that do? It causes irritation and or inflammation, right, we were talking about, resulting in loss of normal function of that nerve. Well, if the nerve going to all of these cardiovascular organs is not working properly or has decreased communication, how can the organ possibly function the way it's supposed to? Right? Now, obviously, there's different factors, right? There's nutrition, there's all this type of stuff. We're literally just talking about the nervous system flow to these organs, okay? So that can only help what everybody else, what all the other practitioners is doing as well, right? So we correct the subluxation, we get the area moving, it relieves the interference in the nerves, opening up the communication and restoring the proper function to whatever that nerve is innervating. These are just a few, there's several of them here. I'm not going to read through all of these, but basically there have been quite a few studies on the relationship between the neck, especially the neck, and blood pressure and heart rate, right? Because all of those are controlled, their hub is up here at your C1, C2, the top of your neck, right at your skull level, where it connects to your spine, right? So that's where those nerves come out, mainly the vagus nerve, okay? Everybody's heard of the vagus nerve? Yeah, right? Okay, so that's the big nerve that starts way up here. So upper cervical issues, right, whether it's muscular tightness due to terrible posture or trauma, things like that, what we do is we go in there, we get all that moving properly so it doesn't affect that vagus nerve, and then obviously anything that innervates downstream, right? Does that make sense? Right, so heart healthy investment is what chiropractic is, all right? Any questions for me? Oh, no, we're doing that after, sorry. All right, and hey, 50% off a visit if you decide to sign up today. All right, acupuncture, Kristen. Down button. I know you have one slide, but down button.
Hi everyone, I'm Kristen. I'm the acupuncturist here. So, as we're talking about heart health, it has been mentioned before that this is one of the leading causes or the leading cause of death in the United States. So we want to do the best we can to prevent heart disease and keep our hearts healthy. So some of the preventative measures that we're talking about is, again, Julia had mentioned diet. Eating a healthy diet consisting of whole foods. Rather than, it's easy to get caught up in processed foods here in the United States. There are so many things that are processed. It's easy to grab a bag of chips and go, or easy to stop off at fast food restaurants and grab something quick. But rather than that, try to get your whole foods in, the colorful, healthy whole foods. So rather than your bag of chips, grab an apple and peanut butter. And peanut butter, you gotta watch what kind of peanut butter you're getting. Not Skippy with 10,000 ingredients. You wanna do the peanuts and salt. So keep it simple, less ingredients is better. Also a healthy lifestyle, including exercise. I know it's getting colder, it's easier to just go home and, cuddle up, grab a coat and take a walk, or do a little exercising at home, exercising daily if you can. And then keeping stress level down as much as we can, because I know here, it's stressful. Life is stressful, and it's easy to get caught up in stress. So there are things that we can do to help with stress levels, including, meditation, deep breathing, acupuncture, yoga. So these are healthy ways to keep that stress level down and keep inflammation down. And acupuncture is something that also helps with inflammation, and it's been proven to help with heart health and help with decreasing AFib and decreasing blood pressure, and also increasing the heart rate variability. So when we talk about heart rate variability, it's the difference in time between heartbeats, and it's actually good to have a higher heart rate variability. So essentially it's, okay, let's say you're in a stressful situation, you're driving and you get cut off by a car, that creates that heart to start pumping and increase stress levels. So having a higher heart rate variability is when you can sort of get back to a normal heart rate. And acupuncture has been shown to help with heart rate variability by stimulating the vagus nerve. The vagus nerve, as Dr. Lilia was just talking about, the vagus nerve controls a lot. And so you can see that the vagus nerve here, let's see, okay, so it innervates all of these organs. So it has so much impact on, the brain, the spinal cord, the lungs, the bronchi, the heart, liver, stomach, spleen, gallbladder, pancreas, kidney, large intestine, small intestine. So it can impact a lot, this vagus nerve. So acupuncture has been shown to sort of connect everything and balance the nervous system. So balancing the parasympathetic nervous system and the sympathetic nervous system. And so the parasympathetic nervous system is the part of our nervous system that is the rest and digest. The sympathetic nervous system, we need the sympathetic nervous system, that's fight and flight. So the vagus nerve is impacted, by acupuncture. So sort of creating balance and harmony between the two parts of the nervous system. So again, breathing, deep breathing is a good way. And so when we're talking about breathing, we can all do a couple breaths together. We want to do some diaphragmatic breathing, some abdominal breathing. And so bringing your, breath down into your abdomen. You can hold your lower abdomen and bring a breath. Let's breathe in for 4 seconds. Feel your stomach come out, and then breathe out slowly for 6 seconds. So in for 4 and out for 6. And that's just one.
You're breathing through your mouth on the way out, right?
Breathing through the mouth on the way. You can breathe through the mouth and the nose on the way out, but focusing on breathing in through the nose, and then out sort of through the mouth. Yeah. And there are so many different ways of, breathing for stress and anxiety and help to calm the system down. So you can even look online and find what kind of works for you and sort of work with your body and see sort of what works for you. There are ways of, breathing in, holding the breath, and then breathing out. So that's another way. But acupuncture also there are specific points that can help to, you know, increase that heart rate variation, and to stimulate the vagus nerve and help to balance the nervous system. So these are just some of the, you know, points that can be impacted, you know. So there's heart 7 on the wrist, and some people even can just, you know, penetrate this point and sort of massage this point. So heart 7 right here by this bone here, right on the crease of the wrist, is heart 7. PC6 is a very common point also for heart health, and it's about 2 fingers in from the wrist crease and right in the middle here. CV17, another point just like sort of in the middle of the chest here. So these are some points, you know, along with the others, liver 3, you know, are common acupuncture points, as well as there are auricular points, so points on the ears that also can help to stimulate, you know, heart health and balancing the system and, you know, creating calming effect. All right, so that's acupuncture for you. And anybody who wants to see, you know, if anyone hasn't seen, you know, an acupuncture needle, I'd be happy to show. You know, people get a little nervous about when they hear needles. It's not a needle that you think of that is like a hypodermic needle. It's very flimsy. I can tie one in a knot. That's how thin they are. Sometimes you don't even feel the needles go in. So very thin and easy. You know, it's acupuncture is a very calming treatment for most people. Yeah, very relaxing. All right, so there it is in a nutshell. Thank you.